Hey guys, so this is about levothyroxine as well. So a crucial point in endocrine chapter of the BNF is thyroid, or the thyroid sort of chapter or topic. Now, why? The Gphc really love to ask about the definition of hyperthyroidism. So as students, you need to know the definition of hyperthyroidism and hypothyroidism, as well as monitoring for the thyroid medication, whether it's amiodarone, levothyroxine, the main ones, carbimazole, which is used for hyperthyroidism, used for Graves' disease. These are very important topics. So, as we said earlier, there was a mention of antidepressants. So, the effects of levothyroxine may be decreased by concomitant treatment with sertraline. So, this is an important medication because you can imagine if there is a patient case scenario where the patient is on sertraline, so they're on a antidepressant, then yeah, the effects of levothyroxine may be decreased by concomitant treatment with sertraline. So antidepressant response to tricyclics can be accelerated, as we mentioned in the previous video, and concomitant administration may precipitate cardiac arrhythmias. So we've talked about the fact that when it's in pharmacy, when you have anything to do with thyroid levels or fluctuation of thyroid levels, it would lead to cardiovascular issues. So concomitant administration with tricyclics may precipitate a cardiac arrhythmia, and that is a very crucial point to talk about. So when it comes to levothyroxine, a lot of interactions are important. So amiodarone, as we mentioned as well, knowing sort of other medication that's linked to sort of thyroid levels, knowing how they interact with levothyroxine. So as we know, amiodarone causes hyper and hypothyroidism. So understanding how it interacts with levothyroxine is very important. So serum concentrations of thyroid hormones can be affected by amiodarone, and close monitoring by a specialist is recommended. So this is very important. So basically, the what you need to know for the exam is how thyroid levels interact based on different changes. Different factors in the body when it's changed. For example, why is it that when it comes to caffeine, so why can you not drink caffeine with levothyroxine? Why must you separate it? Why must you have a gap? Or for example, why can't you take antacids with levothyroxine? Why does there have to be a gap? Or iron or zinc supplements. So the GPHC will expect you to not understand the mechanism of action, but understand that this exists and the importance of it with a patient. So a common theme that the GPHC asks about is urine coloration or skin discoloration or bodily fluid coloration or contact lenses coloration, as well as diet and lifestyle. So a lot of medication interacts with juices: pomegranate juice, cranberry juice, grapefruit juice, green tea, anything green, vitamin K, etc. So you get the theme here. So understanding discoloration of bodily fluids, or discoloration of skin, or discoloration of iris, or even darkening of fecal matter will get you a long way in the GPHC exam. So let's just pay attention to anti-epileptic drugs. This is very important. So anti-epileptic drugs such as carbamazepine, barbiturates, which are sort of more old-fashioned anti-epileptic drugs, are very important when it comes to the GPHC exam. Phenytoin, primidone. So the reason why you should pay attention to carbamazepine, phenytoin, and primidone is because these are category 1 anti-epileptics. So these are the anti-epileptics that need to be prescribed by brand, and they can accelerate levothyroxine metabolism and increase levothyroxine requirements. So beta blockers may decrease peripheral conversion of levothyroxine to triiodothyronine. Levothyroxine accelerates metabolism of propranolol, and that is very important. So levothyroxine may technically clear propranolol faster. So this is a very, very crucial point. Levothyroxine accelerates the metabolism of propranolol, and keep that in mind. So when it comes to sex hormones, or hormones in the body, estrogen increases and androgens decrease serum thyroxine binding globulin. So thyroid hormone requirements may be increased during estrogen therapy and reduced during androgen therapy. Estrogens in oral contraceptives may increase levothyroxine requirements. So there are three main medication that affect how combined oral contraceptives work. And the way I remember it is LTT or LTT. So levothyroxine, triptans, and there was a third medication which I completely forgot now, but just remember LT for now. So levothyroxine and triptans can influence the sort of oral combined contraceptive pills. So this is referring to only combined contraceptive pills. I don't want anyone to be confused and be like, oh, LT just said this. I'm only referring to combined contraceptive pills. So please, guys. Anyway, so PPIs may reduce the absorbance of levothyroxine, orlistat, which is used for if someone's BMI is over 31, and this is very, 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 very important. And thank you so much, guys, and let me keep the video short.